Hi, today we're going to be talking about COPD, or chronic obstructive pulmonary disease. It's a combination of emphysema and chronic bronchitis. COPD is not reversible, but can be treated. You can slow the progression and lessen your symptoms associated with emphysema and chronic bronchitis. First, I'm going to talk about what chronic bronchitis is. Bronchitis, or inflammation of the bronchioles, is persistent mucus production and cough that lasts for 3 consecutive months for at least 2 years. Most often these symptoms occur during the winter. So the inflammation is a cascade of events that ultimately leads to swelling or edema of the airway, or your bronchioles, which are a huge important role in the transportation of oxygen and other gas exchange from your mouth to your lungs. Irritants, such as smoking, increase the mucus production by increasing the number and size of goblet cells, which are what secrete the mucus. Smoking also impairs your ciliary function. Your cilia are little hair-like structures that are on the entire lining of the air system. They help to move things such as mucus up and out of the airway and also keep them from preventing and getting in the airway. Irritants such as cigarette smoke decrease the number of cilia and their function as well. Overall, your lung defenses are compromised, which increases your risk for pulmonary infections and injury. Initially, only your large bronchi are infected by chronic bronchitis, but eventually all your airways are involved. Ultimately, the narrowing of the passages and the mucus production preventing airway getting through leads to less oxygen into your lungs and CO2 out. Emphysema is the other part of chronic obstructive pulmonary disease. It is permanent enlargement of your alveoli, which are little sac-like structures at the end or terminating bronchioles. These are the major components of gas exchange. In emphysema, these become overinflated and they lose elastic recoil, which means they fill up with CO2 and can't get it out properly. Because of this, CO2 builds up in the lungs, and your muscles have to overuse themselves to get the air out. Signs and symptoms of COPD include productive cough associated with the bronchitis and mucus production, shortness of breath even at rest. This is due to the chronic bronchitis and the constriction of your airways, as well as the emphysema and the loss of gas exchange. Wheezing and also cyanosis are a bluish hue to mostly your fingers, toes, and other appendages. This is because of emphysema and the loss of exchange of gases, and oxygen is not being adequately perfused to the rest of your tissues. Some causes of COPD are cigarette smoking, which is the number 1 cause, occupational chemicals and dust, air pollution, chronic respiratory tract infections, most commonly in children, and genetics can play a role in this. Although genetics is the least common of causes and considered very rare, it is important to address with your physician if you think this may be the cause. Talk to your physician about alpha-1 antitrypsin deficiency. To diagnose COPD, a physician may want a history and physical examination, a pulmonary function test, chest x-rays, and ABGs or arterial blood gases. Again, talk to your physician and they'll figure out what's best for you. If you have already been diagnosed with COPD, emphysema, and chronic bronchitis, there are a few things you can do to help. Stop smoking. Prevention is the number 1 key to stop the progression of these symptoms. Or, if smoking is not the cause of your COPD, look at what is causing it and find out how you can stop it. Drug therapy can also be used to help prevent the symptoms. Bronchodilators are very common and help open up your bronchioles or airways to allow the better passage of air into the lungs. This will help increase your ability to exercise and reduce the severity and number of exacerbations. Oxygen therapy is also very commonly prescribed. By providing supplemental oxygen, you reduce the work of breathing and the workload on the heart. Oxygen therapy is a common treatment for hypoxemia, or low oxygen levels in the blood circulation. Airway clearance techniques are also very common. One airway clearance technique is pursed-lipped breathing. If you haven't heard of this before, the goal is to prolong expiration, or getting the air out of the lungs, to prevent airway collapse. Huff cough is another airway clearance technique. Here's how you would do a huff cough. First, you want to be in a sitting position with your head slightly flexed forward and your feet flat on the floor if possible. You're going to inhale slowly through the mouth using your diaphragm. Hold that for 2 to 3 seconds and then forcibly exhale as if you're trying to fog up a window. You can repeat this 2 to 3 times and use it whenever you feel mucus is trapped in your airway. Nutritional therapy is another great alternative. Weight loss is common for people with COPD because eating becomes a task and it's not easy when you feel like you can't breathe adequately. If you feel like you are losing weight or have noticed this trend, try looking into oxygen therapy and other drugs that help open the airway and make breathing easier, and this alone may help you eat better. Also, a dietitian could be a good source to determine what supplements are best for you. If you do have COPD and aren't able to treat it adequately, there are worsening complications that are very serious. One complication I'd like to address today is cor pulmonale. This, if develops, worsens your prognosis significantly. What cor pulmonale is permanent enlargement of the right side of the heart, which can lead to right-sided heart failure in patients with COPD. The result is from pulmonary hypertension, or high blood pressure in your lungs. Because the constricted blood vessels are constricted, you're not getting enough oxygen into your lungs. So your right side of your heart, which controls the blood flow to your lungs, has to pump harder to get it there better. In return, it does become enlarged and ends up being very bad for the patient. If you have COPD, think you are suffering or have seen the signs and symptoms from emphysema and chronic bronchitis I talked about earlier, or know someone who has COPD, there is help. Contact your primary physician or seek out other material to learn what you can do to help prevent your COPD. Thank you.